once in 100 years, healthcare or industry is completely woken up or just completely shook up. And this has happened in the world of healthcare. What we see now is the CMS, Center for Medicare and Medicaid, starting to reimburse physicians for televisits. We've started to see that telehealth, telemedicine, but also remote monitoring has absolutely increased. Can you maybe give us a few thoughts on and would you agree that this has been a shakeup to the world of healthcare?
Yeah, absolutely. It's truly a totally unprecedented shakeup, and I think once in 100 years is not too strong of a claim to make. Telemedicine has been around for 10, 15, 20 years, but it's always been very limited in terms of how it could be used and how it would be paid for. And previously, Medicare and Medicaid and most insurance companies, at least in the US, had extremely narrow definitions of when they would pay for healthcare. There were very restrictive rules that said the patient has to be in a rural area, they have to be more than X number of hours from another hospital before insurance would pay for telemedicine. And so it just never gained broad acceptance because there wasn't this payment, and physicians really couldn't get reimbursed for the time spent caring for that patient. And overnight, a couple of weeks ago, Medicare and Medicaid, with $1 trillion budget, said as long as the care is being delivered to the patient, it can be fully virtual, and Medicare and Medicaid will still pay for it. And now we've seen all of the other major insurance players, the Cignas, the Blue Cross Blue Shields, we've seen all of the major insurance carriers now start to shift and start to pay for telemedicine in the exact same way that Medicare and Medicaid has. And so I think we finally opened the floodgates and said, as long as you're caring for that patient, as long as you're delivering and providing them access to healthcare services that they wouldn't be able to access otherwise, we will reimburse for that. And so, I think every system has seen thousands of percentage point increases, and it's really thousands. It's like 5,000, 10,000 percentage point increases in the number of telemedicine visits that they're doing. And we're now hitting these crossover points where healthcare systems are doing more visits remotely than they're doing in clinic, even with this COVID rush. Even with all of the surge in COVID patients we're seeing, they're still doing more visits remotely, which is pretty spectacular and crazy to think. And I think the feedback in general is that patients are really appreciative of the flexibility that remote care gives them, the ability for them to get on the phone with their physician, do a video visit, do a checkup, check in on how their heart is functioning, check in how their lung is functioning if they have chronic disease, without having to take the time to go into the clinic and without exposing themselves to other pathogens.